If you're over 60, I need your full attention, because this could save your health. UK doctors are sounding the alarm about a common bedroom habit that many older adults think is harmless: pushing the body too hard during intimacy without considering age-related changes. Here's the truth: as we get older, our hearts work harder to maintain blood flow, our blood pressure reacts more slowly, and our joints and muscles take longer to recover. Yet many still approach intimacy with the same intensity they had in their 30s or 40s, ignoring signs like breathlessness, dizziness, chest pressure, or extreme fatigue. These are not just part of aging. They can be early warnings of cardiovascular strain, circulation problems, or even a heart attack. The danger increases when intimacy follows alcohol, heavy meals, or certain medications, creating the perfect storm for a medical emergency. This doesn't mean giving up on closeness. It means adapting. Slow down, listen to your body, choose joint-friendly positions, and rest when needed. Think of intimacy the same way you think about exercising. It should energize you, not exhaust you. Protect your heart now, and you can keep this part of life joyful, safe, and satisfying for years to come. Here are the 4 main topics for this video. After the age of 60, the body's ability to handle physical stress changes significantly. And one area where this is often overlooked is in the bedroom. Many people assume that if they feel generally healthy, they can approach intimacy exactly as they did in their younger years. However, intense and prolonged sexual activity can put a considerable strain on the cardiovascular system. During arousal and orgasm, the heart rate and blood pressure naturally increase, but for someone over 60, these spikes can be much more pronounced. The heart has to work harder to pump blood efficiently, and if there's any underlying heart disease, even if it hasn't been diagnosed yet, this sudden demand can trigger dangerous events such as arrhythmia, angina, or, in severe cases, a heart attack. It's not just the duration but the intensity of the activity that matters. Rapid, high-energy movements or prolonged sessions without rest can keep the heart rate elevated for longer than is safe. Imagine sprinting up a hill without a break. For someone over 60, that same kind of physical exertion in a sexual context can be equally taxing. What's more, sexual excitement releases adrenaline, which, while pleasurable in the moment, forces the cardiovascular system into high gear. This can be risky if the blood vessels have lost some of their elasticity, or if the arteries are partially blocked, which is common as we age. One of the problems is that many people don't notice early warning signs. Lightheadedness, shortness of breath, chest tightness, or unusual fatigue during intimacy are often dismissed as just getting older. But they can be red flags that the heart is under too much strain. The safer approach is to pace activity, take breaks when needed, and pay attention to the body's signals rather than pushing through for the sake of performance. Even if someone feels confident in their stamina, there's no harm in adjusting the style and speed to protect long-term health. Slower, more controlled movements not only reduce cardiovascular stress, but can also enhance intimacy and connection. Using supportive positions that minimize physical strain allows couples to enjoy a fulfilling sex life without putting themselves at unnecessary risk. The takeaway is that passion doesn't need to disappear after 60. It just needs to be balanced with the wisdom of listening to the body and understanding its limits. Hormonal changes after the age of 60 can have a significant impact on sexual health, and ignoring these shifts can lead to long-term problems in the bedroom and beyond. For men, testosterone levels naturally decline with age, which can result in reduced libido, softer erections, and slower recovery after sexual activity. For women, menopause brings a drop in estrogen and progesterone, leading to vaginal dryness, thinning tissues, and changes in natural lubrication. These changes don't just make intimacy less comfortable. They can also increase the risk of small tears, irritation, or infections if sexual activity continues without the right precautions. The problem is that many couples assume discomfort is just something to push through, or that it's an unavoidable part of aging. In reality, forcing sexual activity without addressing hormonal and physical changes can cause cumulative damage over time. For example, repeated friction in dry tissues can lead to chronic inflammation, which in turn may contribute to reduced sensitivity and long-term discomfort. This can create a cycle where pain leads to avoidance, avoidance causes further loss of elasticity, and intimacy becomes even more challenging. For men, low testosterone isn't just about desire, It can also affect muscle tone, energy levels, and even mood, all of which play a role in how satisfying and safe sex feels. In some cases, men may turn to over-the-counter supplements or unprescribed testosterone boosters without understanding the risks. These can cause side effects like high blood pressure, fluid retention, or worsening of existing heart conditions, all of which are already concerns in this age group. The smarter approach is to work with a healthcare provider to assess hormone levels and find safe, medically supported ways to manage changes. For women, this might mean using a good quality lubricant, or if appropriate, exploring estrogen creams or vaginal moisturizers to restore comfort. For men, medically guided testosterone replacement therapy may be an option, but only with proper monitoring. The takeaway is simple: intimacy after 60 can still be incredibly rewarding. But the body's hormonal landscape is different, and pretending otherwise can do more harm than good. By addressing changes directly, instead of ignoring them, couples can protect their sexual health, avoid unnecessary pain or injury, and enjoy more satisfying, stress-free intimacy well into their later years. One of the most overlooked risks for people over 60 in the bedroom is the strain that certain sexual positions or vigorous activity can put on the body, particularly the heart, joints, and back. As we age, flexibility naturally declines, bone density may reduce, and joints can become stiffer due to conditions like arthritis. What might have felt effortless at 30 can place significant pressure on muscles, tendons, and ligaments later in life. This is why continuing with the same intense or physically demanding bedroom habits without adaptation can lead to injuries, sometimes ones that take months to fully heal. For individuals with underlying cardiovascular issues, the risk is even higher. Sexual activity can momentarily raise blood pressure and heart rate, which is usually safe for healthy individuals, but may be risky for someone with untreated heart disease, high blood pressure, or a history of stroke. Overexertion during intimacy could trigger chest pain, shortness of breath, or even a cardiac event in those with compromised cardiovascular health. Many people underestimate how much energy is involved in sex, forgetting that it can be as demanding as climbing a couple flights of stairs. And the body's ability to recover slows with age. Even beyond the heart, certain positions that put pressure on the spine or require sustained weight bearing can aggravate back problems, hip pain, or knee issues. This is particularly true for people who had hip replacements, spinal surgeries, or chronic joint conditions. Ignoring these physical limitations can turn what should be a pleasurable experience into one that causes lingering discomfort or forces you into recovery mode. The key isn't to stop being intimate, but to adapt the approach. Choosing positions that reduce strain on joints, incorporating more supportive pillows, and pacing the activity can keep the experience safe and comfortable. Gentle, slower intimacy doesn't mean less satisfaction. In fact, many couples report it brings a deeper emotional connection. What's important to remember is that physical changes after 60 are not a sign that passion has to end, but they are a sign that habits should evolve. By respecting the body's current capabilities, couples can continue to enjoy a vibrant and fulfilling sex life without the risk of injuries, strains, or health scares that could otherwise be avoided. Another critical but often ignored issue for those over 60 is how certain bedroom habits can quietly impact urinary and reproductive health. At this stage of life, both men and women experience natural changes in pelvic floor strength, hormone levels, and tissue elasticity. For men, prostate health becomes a bigger concern, and for women, thinning vaginal tissues and reduced lubrication can increase the risk of irritation or even small tears during intimacy. If these factors are overlooked, the result can be lingering discomfort, inflammation, or infections that could have been prevented with minor adjustments. One common but risky habit is neglecting proper aftercare following intimacy. Skipping a simple post-activity hygiene routine can allow bacteria to linger, potentially leading to urinary tract infections, UTIs, which tend to be more severe and recurrent in older adults. For men, unaddressed prostate swelling or irritation can worsen over time if symptoms are ignored, while women with weakened pelvic floor muscles may notice more bladder leakage or discomfort after certain positions or movements. What might seem like a minor annoyance can escalate into a significant health setback if left untreated. The hormonal changes of later life also make tissues more delicate, Women in postmenopause often have less estrogen, which means the vaginal lining is thinner and more prone to microtears, especially if foreplay or lubrication is insufficient. These small injuries may not always be felt immediately, but they can increase the risk of infections and ongoing discomfort. Men, too, may find that aggressive or prolonged activity can cause penile irritation or exacerbate conditions like Peyronie's disease, which is more common with age. There's also the reality that older adults often take medications, from blood thinners to heart drugs, that can affect healing, blood flow, and even sexual function. If certain bedroom habits lead to repeated irritation or strain, the recovery period could be longer and more complicated. Being mindful of the body's limits and making small adjustments, like using medical-grade lubricants, improving pelvic floor strength through exercises, and staying hydrated, can dramatically reduce these risks. The truth is, intimacy over 60 can be deeply rewarding, but it requires more awareness and care than in earlier decades. By avoiding habits that stress already sensitive areas and by prioritizing gentle, well-supported experiences, couples can preserve not only their sexual health but also their overall well-being. Ensuring pleasure stays a positive force rather than a hidden health hazard. As we age, intimacy should become smarter, not riskier. The body may not recover as quickly, and small oversights in the bedroom can have consequences far greater than they did in our younger years. By paying attention to changes, avoiding harmful habits, and adapting with care, you protect not just your sexual health, but your overall quality of life. Passion doesn't have to fade after 60. It simply needs to be nurtured with wisdom, respect, and a deep understanding of your body's needs.